Thanks for calling,
yeah.
calling attention to this issue. I was in the hearing yesterday for the markup for the Department of Health and Human Services and heard once again that we were just cutting out fraud and waste. Can you tell me, any of you, from your own personal experience, what the typical outcome is for a researcher who has a grant discontinued? What happens next?
I think the short answer is we don't really know, and it depends. I think in some cases they're able to find resources from their home institution for a while. In other cases, those resources aren't available, and the project is discontinued and cannot easily be restarted. There have been so many terminations of grants, including hundreds that were just revealed yesterday or the day before, that it's an ongoing process to try to keep track of everything that's happening.
Yeah, I just can add. I mean, I think that depending where one is in one's career, it might mean that you give up on science, that you give up on research, and that you go into another sector. We've also seen reports of people going to other countries who can get research funding elsewhere. In public health research, that doesn't really work because everybody's really depending on us here in the U.S. in terms of world leaders in a lot of the conditions that only the U.S. is really, investigating, whether it's Ebola or Zika or something like that. So I think early career people may be moving into something else. More senior or mid-level researchers are losing their staff, and it's a waste of government money in terms of the investments and a loss of future return on investment in terms of the patents and the lives saved.
Tell me about the argument that I hear from them that the United States is doing more than its fair share of research. It's time for other countries to step up. What about that argument?
We have an incredible legacy of leadership, invention, discovery, and prosperity because of the research and the science infrastructure. I think my colleague from NIH could probably say more, but I think that from the CDC's perspective, people around the world come to the CDC to learn how to do things and then take them back to their own countries and make them healthier and safer. So I think we all become healthier and safer by there being more capacity in research and of course, in prevention as well.
Let's speak for a minute, if I can ask you, on the issue of lead poisoning. Congress funded the Childhood Lead Poisoning Prevention Program at CDC with $51 million, and with federal funds, the Chicago Health Department reduced the rate of children with elevated blood levels from 70% in 1996 to 2% today. The entire division working to prevent kids from being poisoned by lead was fired. Given how much progress we've made to address child lead poisoning, what do you think is the impact of eliminating this office?
This is really devastating because when a child is exposed to high lead levels,
and there's no safe level.
No safe level, but when a child is exposed to lead, they lose intellectual capacity. They don't get it back. So it's really irreversible and devastating. And as we spoke earlier, an outbreak in Milwaukee schools, a call for help from the CDC, the program is gone. There's no one to respond to it. And for those children that are exposed and the states that depend on the expertise, it's really tragic.
I asked Secretary Kennedy yesterday what was the #1 preventable cause of death in America today, as he's spoken about how bad our health was generally. He couldn't come up with the answer, and the answer is tobacco. It's an issue that I've been working on for a long time. And it just strikes me as this is a gift to big tobacco to decimate the FDA Center for Tobacco Products, firing its director and most of its employees. How does the CDC's Office of Smoking and Public Health prevent tobacco addiction for kids and help adults quit?
Yeah, thank you so much for your support over the decades. The Office of Smoking and Health at CDC worked very closely with the FDA and was supporting states in the quit line, in the tips from former smokers, in the ability to link policy with prevention, and is estimated to have saved over 100,000 lives through the simple quit lines that we had for through the congressional support.
10 years ago when I went to see a great American named Francis Collins at NIH. And I said to him, I'm old enough to remember when 3 members of Congress came together and had a goal of doubling the NIH budget, which they did. It was nothing short of a political miracle, bipartisan effort. Included John Porter, a congressman from the Republican congressman from my state of Illinois. And I asked Dr. Collins, I said, I can't double it. I don't think that's realistic. It's about $40 billion now. What can I do? He said, give us 5% real growth, consistent, predictable real growth, and good things are going to happen. And he kind of felt, and I felt as well, it would create a bandwagon effect. People would be so impressed with how much we discovered. And I set out to do it. Patty Murray was my partner in that for obvious reasons. She's one of the best. But in addition, Roy Blunt, conservative Republican, state of Missouri, led the way in the Appropriations Committee, and Lamar Alexander from the state of Tennessee. The 4 of us in the span of 10 years went from $40 to $60 billion at NIH. What's going to happen now with the proposed budget is to wipe out the whole 10-year progress, 10-year addition. We'll be back to the 40 billion figure. And I think the impact on researchers, even on those who would go to school to prepare for that kind of life, has got to be devastating. And the point I made yesterday to Senator Kennedy, it isn't just the loss of research, it's the loss of hope. I talked about a friend of mine named Wallach, who has ALS, and his wife, Sandra Bavaya. And I said to them, this research is more than a possible cure for his ALS. It is hope that keeps him hanging on for another day or another week. They contacted me last night and said, you're spot on. It's exactly what it is. I think about that. So it's not just the loss of research. It's the message that we're sending about hope as to whether or not a cure can be found. What a heartbreaking development. Hard to imagine. I don't think Americans were voting for that in the last election. Thank you, Peter.